This video is the next in my series of videos dealing with college football and COVID-19, and I lately have been looking at Dr. Venkatesh Murthy. He is a cardiac radiologist, and he's been taking a long, hard look at the Journal of American Medical Association study that was at least part of what the Big Ten was concerned about. This study dealt primarily with the effect of COVID-19 on the myocardium of athletes, and of course persistent myocarditis. What he questions is the statistical relevance of some of what was found, even the actual methodology of the study itself. So I'm not a scientist and I'm not a doctor, so I am teaching myself how to read these things. So you'll learn as I learn, but he questions some things in terms of the presence of other factors. So we talked earlier about cytokines, and now we're going to look about troponins. Troponins are one of the major indicators of heart damage. They are a very sensitive indicator and a major indicator of things like myocardial infarction, also known as heart attacks. So he was looking at some of the levels cited and, like I said, other things that he thought should have been taken as co-indications that could have been there beyond COVID-19 that might have played into the cases of myocarditis that were found. And two, he wondered if some of them were basically temporary. And once again, I'm not a doctor, but from what I was reading in his answer to the article, he seemed to indicate that some of the things that were cited there were things that could have been exercise-induced or temporary in nature as opposed to persistent. Much more as I learn more about this.